Hi, everybody. It's Dr. Eric Balcavage, and we are getting ready for our latest edition of the Thyroid Answers podcast. And with me, as always, I have my partner, Dr. Erica Riggleman, who is on all the time with me to do our podcast. Good afternoon, Dr. Riggleman.
Hey,
how are you?
Good. How are you?
I'm doing great, and I'm really happy to have on a good friend of both yours and mine, Dr. Brady Wirick, who's a chiropractic physician, but also a functional neurologist. And we're going to talk to him about what he does as a functional neurologist. And we're going to talk to him a little bit about the connection between neurologic problems and thyroid problems. And there should be a ton of great information that we get out of this podcast. So without any further ado, let's introduce Dr. Brady Wirick. How are you?
I'm great, guys. How are you?
We are great. We're happy to have you on. As I told our listeners and our viewers, you are a functional neurologist. Now, while Dr. Eric and I both know that we've had some training in functional neurology, you've had extensive training in functional neurology. And so one of the things that people may not know is what the difference between a neurologist, like a medical neurologist, is and a functional neurologist. Can you kind of explain the difference?
Absolutely. That's actually a great question, and one that I get asked all the time. It's kind of funny, but there's a backstory to it, though. As the nature of our businesses and what we do for a living, we travel a lot to different seminars. We're on airplanes a lot, and people ask me all the time what I do for a living. And if I tell them I'm a chiropractor, I get one of two reactions. I either get them buddying up next to you and wanting an adjustment on a plane or right there on the plane, or they give you the deer in the headlights look and they kind of scooch away from you. If I tell them that I practice functional neurology, they kind of look at you with that blank stare like, what is that? So over the years, I've really come to struggle with how to explain that to someone in 30 seconds. And the way that I do it now is people understand if you want to build a bigger bicep, how do you do it? You exercise the bicep, right? So if you exercise the bicep and you feed it nothing but McDonald's, does that bicep get bigger? Well, it might, but not the right kind of big, right? So functional neurology is basically this. Your nerves work on that same principle. So if you exercise a nerve and give it the adequate fuel that it needs, you can actually grow new nerves and make those nerves stronger just like you could a bicep. Okay, so the difference, and there's a little, when it comes to what the difference is between what we do and what the medical neurology does, medical neurology are medical physicians that are trained in neurology, but they're trained to find what we call STDs, and it's not what everybody thinks, okay? It stands for strokes, tumors, disease. So if you have one of those three things, you are in the medical neurologist's realm where they're going to prescribe either surgery, drugs, or something else to help manage whatever that disease process is. If you don't fit into that little mold, then oftentimes you're told it's in your head, there's nothing can be done, you need to learn how to live with it, blah, 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 blah. Okay? That's where we come in. We're the ones that look at the function of the nervous system. Where are the deficits? What can we do to rebuild those deficits? What can we do to feed these nerves appropriate nutrition to actually get them to come back and make a substantial difference in people's lives?
Okay. So if we kind of talk about what a functional neurologist does versus a medical neurologist, it's fairly simple to what we see in medicine versus functional medicine. In traditional medicine, whether it's neurology or just a regular medical doctor or gastroenterologist, they're really good at diagnosing the name of a condition and treating the signs and symptoms with medication or surgery. And that's about the same for a traditional medical neurologist. But in the functional neurology world, what you're really focused on is identifying where the neurology or the nervous system's compromised and actually bringing it back, exercising, giving it the dietary things it needs, the nutritional things it needs for the tissue to heal and repair, correct?
That's exactly right. That's perfect.
Awesome. And I know that Eric and I have both had some training in functional neurology, and I know you've spent much more time working with functional neurology. And one of the things that I know that you've kind of come up with as you're dealing with patients and helping them understand what's wrong with them is an acronym, BAD brain, right?
Right.
And so maybe we should talk about that, because as Erica and I talk about hypothyroidism, and we identify the difference between glandular hypothyroidism and cellular hypothyroidism, we've talked about many times in the podcast that the symptoms people experience when they're diagnosed with hypothyroidism, or if they search for hypothyroid symptoms, those symptoms are all a result of what's happening at the cellular level and the nervous system cells as well. But as a functional neurologist who also treats people with hypothyroid conditions, you look at this bad brain kind of metaphor you have, or this acronym you have, and it's interesting, a lot of those symptoms are the same things our patients with hypothyroid symptoms complain about, right?
Absolutely.
Exactly.
So can you go through that with us? What does bad brain stand for, and how do you explain that to your patients?
Yeah, absolutely. We'll go through this. What's interesting is, when we do educational seminars here in Idaho Falls, when we start talking about the thyroid, I actually lead with this acronym, and I don't tell people what it's for. I just go through it, so I'll go up on the whiteboard and I'll write out. I'm writing it out for myself right now, so I'm not prepared, but I'll go through and I'll write down, the first B, it's bad brain. Okay, so the first B stands for brain fog, which, tell me a thyroid patient who doesn't have brain fog. Okay, then A and D are both anxiety and depression. Okay, then get into the brain. Then we start talking about B is bowel and bladder loss. We see those a lot in especially some of the older thyroid patients. And then retention, the R is for retention, which means like basically walking into rooms forgetting why you're there. Okay. The A stands for anosognosia, which is a fancy word for saying a sensory problem that you didn't know that you have. And those, you really can't find those until someone like one of the three of us will sit down and actually do an exam with people and find out that they have some sensory deficits. The I stands for insomnia or sleep problems. And then the N actually stands for nerve pain, or pain that there's really no excuse for you to have. That part of your body should not hurt, but it's causing you tremendous pain. That's nerve pain. So when we go through those, I'll list those out, and I'll ask the people, how many of these are thyroid symptoms? And then it's amazing to watch people go through the whole list and go, well, they all are symptoms of thyroid problems. And what I hope we get into today is to make that link between hypothyroidism, specifically cellular hypothyroidism, and the link to the nervous system, because you can't affect one without affecting the other.
That's absolutely true. I mean, the reality is that the brain and the nerves control everything. I mean, if our brain and nerves weren't there, weren't working, we wouldn't be alive.
That's exactly true. And to me, the reality is this. When one of the three of us take on a patient, whether, in my office, we do a lot of work with diabetes, we do a lot of work with neuropathy, we do a lot of work with thyroid. When we take on these types of patients, we're not treating their thyroid. We're not treating diabetes. We're not treating neuropathy. We're helping the brain. We're helping these people save their brains and save them from going on these degenerative processes that are destroying our healthcare system.
Yeah, absolutely. So when we talk about thyroid function, the reason it's so important to have healthy thyroid function is because you need thyroid function to have healthy cellular function and healthy cellular metabolism. And the nerve tissue and the nerve cells are no different. They require healthy thyroid function as well. So there is a delicate balance, and there's a major crossover between the symptoms you see with people with neuropathy type conditions or neuralgia or brain or nervous system conditions and those that have thyroid conditions, because under stress condition, physical, chemical, emotional, or microbial, we trigger inflammatory mechanisms. We trigger what we call the cell danger response. And when you trigger this cell danger response, cellular health reduces. And it's going to reduce cellular health, cellular capacity, and the nervous system is a part of that whole system. So absolutely, it's really important that we take a look at people who come in with any type of condition, we need to do a thorough neuro exam as well as a thorough metabolic exam, especially for our hypothyroid patients.
Right.
How do you distinguish between the two? If the symptoms are so overlapping in your clinic, how do you distinguish between a purely neurological problem or purely a thyroid problem, or is it that most patients are a complete mix?
Look, there's an old saying that says, when all you have is a hammer, all you see is nails. Mm-hmm. Hey, but when I bring people into this office, number one, they've got an autoimmune problem until I prove otherwise. Okay? And number two is their metabolic problems that they have are affecting their nervous system and causing the nervous system to malfunction. Okay? So is there a distinction between the two? Well, to me, there's not. They're one and the same. Because if you don't get adequate fuel, which is glucose and oxygen to the brain is going to suffer. So when I see these people coming in here with thyroid disorders, their brain is in trouble because they're not getting adequate fuel to the brain. They're not getting adequate neurotransmitters to the brain, and it is an issue. It's a big issue, and you cannot fix that with medication.
That's very true.
Yeah, absolutely. And there's a huge connection between the gut and the thyroid, right? We kind of already talked about that. But there's also a huge connection between the gut, the brain, and the thyroid, right? The most common cause of hypothyroidism is a autoimmune condition called Hashimoto's. And Dr. Erica and I have talked many, many times about the impact that inflammatory mechanism and infections have on causing autoimmunity. Bacteria from the gut, the yeast from the gut can translocate into the lymph tissue, into the bloodstream, and especially the lymph tissue get right into the thyroid gland. And the thyroid gland is unique in that it can mount its own autoimmune attack without immune cells, which is unique to the thyroid gland. But if the gut is bad, right, the brain's bad, right? If the brain, the gut is going to be bad because those two systems are connected a bit, right?
Right. And so let's talk about that connection here for just a second. How does our body get nutrients?
Absorption through the GI tract. So good nutrition, good digestion.
It gets absorbed into the bloodstream, and then the bloodstream is going to carry nutrition to wherever it needs to go, right?
Absolutely.
So 33% of whatever you eat gets consumed by your brain and your nerves. So if you look at this from an anatomical perspective, we take nutrients from the gut, are going to go in through the heart, okay, and they're going to get processed through the heart. When they come out of the heart, they come over the aortic arch right here in your chest. Okay, so you've got this big artery that comes over, makes this arch like this, and then there's three branches that come off right here, the first three branches. Guess where those first three branches go?
They could possibly go to your brain.
To your brain? Nice. To your brain and to a very specific part of your brain called your cerebellum. Now, your cerebellum sits right here at the base of your skull. Its primary functions are to control balance, coordination, spinal muscles, and eye movements. But what people fail to realize is that there's also direct connections from that cerebellum to a part of your brain right here between your eyes called your hypothalamus and your pituitary. So when you have inflammatory stress coming through food, it's going to affect the cerebellum. The cerebellum is going to lose its input going into that hypothalamus and pituitary, and that directly yet indirectly affects proper thyroid and proper hormone function.
Absolutely. So if for those people who are listening, if you don't know, the hypothalamus is a kind of a major regulator in the brain, and the hypothalamus releases a product called thyroid releasing hormone, which stimulates the pituitary gland to say, hey, pituitary gland, we need to make something to stimulate the thyroid gland, right? Pituitary gland makes something called thyroid stimulating hormone that then goes down and stimulates the thyroid gland and says, hey, start making some T4 and T3. And those are the two primary forms of thyroid hormone. So what Dr. Brady's saying is that if you have inflammatory mechanisms in the body because of your diet, your lifestyle, not only can it directly dysregulate the gut, create inflammatory mechanisms there, which could directly impact thyroid function at a cellular level. It could change the conversion of T4 to T3 at the cellular level, decrease the transport of thyroid hormones in, but it can also directly impact the brain and the brain's ability to make thyroid releasing hormone. And one of the things that will happen there is suppression of the pituitary gland, because if you have inflammation that suppresses the hypothalamus, you're not going to make thyroid releasing hormone. You're also not going to make sufficient levels of TSH. So you're not going to necessarily, you may not produce T4 and T3, not because you're not hypothyroid, but because the brain is inflamed and it can't make the hormones that are precursors. You want to add to that, Erica? Did I miss anything?
No, I mean, that's, you went over a lot of the neurology of it and the mechanism of it. Yeah, I mean, the brain is the initiator of most of the endocrine system. And so talking about the hypothalamus, it's a crucial part, and brain function plays a big role in that. I think another big part of, the nerves that are in the brain, looking at the brainstem and all the cranial nerves, is going to be the vagus nerve, and the importance we've talked about on previous podcasts about the importance of the vagus nerve and the vagal tone and how that directly can impact the gut, which can lead to thyroid symptoms of constipation and other leaky gut symptoms. From your neurological perspective, what do you see with vagal tone, and how important is that to gut health?
It's everything. I mean, it's, first of all, you're dead on, Erica. I mean, that was just spot on. But when you decrease vagal tone, you decrease gut motility. When you decrease gut motility, you decrease absorption. When you decrease absorption, you decrease brain power, period. And if I could just link one more thing back into that pathway that you just talked about, we start talking about depression and anxiety, right? With these thyroid patients.
Mm-hmm. Yep.
Most of these cases are deficiencies or problems with serotonin production. And where is most of your serotonin produced? It's in your gut.
Yeah. Upwards of 90% is produced in the upwards. 95% is what I've talked about. I think it's about 5% in the peripheral tissues, and maybe 1% is actually produced in the brain. So much less than people think.
Yeah.
Right.
So let's keep on that kind of that line that Erica was talking about, because we're talking about, and what you're talking about with neurotransmitters, because when we're talking about people with thyroid problems, we're often talking about what their symptoms are and trying to help their symptoms. And if we tie in serotonin there, serotonin is a major neurotransmitter. And Dr. Erica and I have talked about this on previous podcasts, that tryptophan, which is an amino acid from your foods, from protein-based foods typically, is the main kind of precursor to serotonin. And most people think that high levels of serotonin are produced in the brain. They are not. And the primary focus of tryptophan that's absorbed goes to protein production. The remaining portion of tryptophan goes, we talked about this, I think, a podcast or two ago, 90% of that goes down the kynurenine pathway to support the couple of the products in the kynurenic acid, quinolinic acid, picolinic acid, but primarily NAD, which is critical to overall health and function. Under stress conditions, we see people take, instead of about 5 or 10% of that serotonin, tryptophan going to serotonin production in the gut, a lot of that tryptophan is going down that serotonin, going down that kynurenine pathway. Right. But when you see people with stress, depression, and you consider what you need to do with them, are you often looking at the gut as a primary factor as to what's causing their depression?
Absolutely. You think about it, when people are depressed, they start talking about comfort food. Mm-hmm. And where do they go for comfort food?
Yeah, they go to their friend carbohydrate. Typically.
Carbohydrates, gluten,
dairy,
sugar, all of these things, are dopamine producers. I'm sorry, what's that, Erica?
Don't forget wine.
Don't forget wine. Hey, I'm not going there. But people will go to these foods because they're depressed, because their brain will make more dopamine when they eat these foods. And as a result of that, it makes them feel better. Mm-hmm. But it's also making the problem worse because it's driving the adrenal pathways, which we didn't talk about, which we could probably take another hour to talk about. But they drive those adrenal pathways that ramp up cortisol, epinephrine, and norepinephrine production. That increases the nerve pain type symptoms that you see and decreases the absorption of thyroid hormones, etc. But it's just, your gut will no longer be able to produce serotonin when you're doing that. You cannot eat Twinkies to get out of depression because of you're blocking serotonin pathways, period. Yeah, it feels good while you're doing it, but end result is bad brain.
Yeah, definitely. And most of the time they feel guilty after they've eaten it, and it just becomes this vicious cycle that keeps going and going. Right.
It's sad. Yeah. And then they show up to their medical provider and tell them that, and the medical provider just writes them a script. Mm-hmm. And it just says, it's a funny thing. There was it's not really funny, but 9 years ago, when I went through testicular cancer, I went through chemo and experienced depression for myself. It was horrible. I know what that's like. Hey, and Lexapro was my best friend during that time because it really got me out of it. But we had to fix the problem because I couldn't just stay on that stuff for the rest of my life.
Yeah.
So I lost you guys for a little bit. I'm not sure what happened, but
we didn't even notice you were gone.
I caught the tail end. But one of those things that we see with serotonin and depression is that, and I presented at this at ShyCon last week or so ago. I forget how long ago that was now. It seems like it could just happen, but it's also probably a couple weeks ago. Is that depression is actually not something that we should be surprised we have when we have chronic illness. It's actually part of that cell danger response, and it's actually a normal mechanism. Stress, infection, inflammation actually upregulates the clearance of serotonin. So two things that we've talked about, Brady, is that when somebody has chronic stress, chronic infection, the cell danger response going on, they're going to upregulate the kynurenine pathway to produce more quinolinic acid, which is neurotoxic, and that's designed to help kill organisms and kill the threat. And we're going to have a decreased production of serotonin along with an increased metabolism of the serotonin that's being made. So those three things will give us low levels of circulating serotonin and cause us to be depressed. And It's not something that we should be trying to medicate away. The body is doing that as a natural defense mechanism to say, hey, lay the heck down, recover, chill out, and give the body time to recover and relax. But we often see it in practice. I'm sure you see it quite a bit. Almost all of our hypothyroid patients are going to see that at some level. They may not want to admit it, but they're going to probably have it at some level.
Right. Well, you're missing a huge point there too, Eric, and that's when you don't have proper thyroid hormone levels, you can't produce normal neurotransmitters in the beginning.
Absolutely.
So, I mean, you're kind of damned if you do, damned if you don't. Unless you get after the gut, fix the gut problems, reduce the stress issues, you're never going to medicate your way out of these until you do that.
Absolutely. You can't. And if you try and medicate with SSRIs or MAO inhibitors, one of the things that you're going to wind up doing is something you talked about, I think, while I was kind of off in Never Land somewhere there, is that you actually inhibit the clearance of your catecholamines. So you just wind up jacking up your catecholamines, increase stress response, and you wind up then with sympathetic dominance, and now parasympathetics don't work, and you can't digest, and the vicious cycle just continues.
Right.
It's interesting. I heard somebody talk on another podcast, and they said that they don't see reduced parasympathetic activity too often. Now,
what for it?
Yeah, it kind of caught me off guard that when they said that, and obviously I couldn't respond because it was a podcast. But in my practice, I see reduced parasympathetic activity. Erica, do you see reduced parasympathetic activity in your?
Yes, a lot of the times.
And Brady's as a functional neurologist, you'd be the best person to say, hey, this is fairly common in our overly stressed patients.
Absolutely. Right. What do you see? Hey, what does the parasympathetic system do? Well, it's our feed or breathe nervous system, right? So decreased digestion, decreased gut motility, increased constipation, everything else. But these are also the people they've lost their sex drive. They've lost their libido.
Right.
Because they're sympathetic dominant. So you can't tell me that you're not seeing sympathetic, parasympathetic issues with these patients, because it happens with every single one of them.
That's why you see so many Viagra commercials on TV.
Exactly.
Right. So it was an interesting comment that caught me, and I usually listen to the podcast at like 1.5 speed, so I had to go back and redo that a couple times. And this is a person who said a lot of the right things along the podcast, but then I heard him say, we don't really see lack of parasympathetic activity, and I'm like, I see it all the time. The person has no gag response, their eyes are dry, they've got reduced motility. I mean, these are all signs of reduced parasympathetic activity.
Right.
And we were talking a little bit about with our hypothyroid patients, and Erica mentioned constipation. We were talking about serotonin, and serotonin is huge in motility issues, right?
Absolutely.
So from a neurology standpoint, serotonin is a wee bit or really important when it comes to GI motility.
It's absolutely. The GI has its own esoteric nervous system. It has its own set of nerves, completely separate from everything else. Well, completely, but still linked. Okay? So it's absolutely essential for gut motility, digestion, and all of the other issues to have serotonin production.
Right. So if somebody has hypothyroid symptoms, they do have thyroid problems, they do have cellular hypothyroidism, they do have constipation issues. One of those things, especially if they have depression as well, one of those things that they could potentially use as a prokinetic, something to get that bowel motility going, is something like 5-HTP, correct?
Yep.
Yeah. So there's a number of prokinetics, but one of the key things, and especially when we tie in SIBO, and we're going to talk to one of the directors of one of the labs in a couple weeks, is the kind of the rise in SIBO and what one of those links is. But definitely lack of reduced thyroid function can play a massive role in reduced motility of the bowel and lead to SIBO. And one of those factors that could play a major role is what's going on with low levels of serotonin, because serotonin needs to stimulate those 5-HT receptors in the gut to help stimulate that migrating motor complex.
That's important.
Right.
Brady, I know that you see a lot of neuropathy patients in your office, and that's a big part of what you do. Do you often see that thyroid dysfunction plays a role in some of these neuropathy patients in the etiology of what's causing their neuropathy, or kind of prevents them from getting better with, standard treatments?
Heavens, yes. First off, let's just define neuropathy. A neuropathy, by definition, means nerve problem, which is kind of silly because it doesn't really tell us anything about it. But neuropathy patients will typically see numbness, burning, tingling, or pain in their hands and feet. That's the most common presentation. Now, 30% of neuropathy patients are diabetic. Okay, so what about the other 70%? Well, unless they've had chemotherapy, they fall into this lump that's called idiopathic neuropathy, which basically means we don't know why you have neuropathy. But once you start digging into their histories and looking a little bit more, I would like to actually see how many of these patients are on thyroid medications.
I know a lot of mine are.
I would tell you there's a large percentage of the patients I see that that they have hypothyroid conditions, right?
Oh, yeah.
And so if you tie in that idiopathic, I usually say if somebody tells you have idiopathic neuropathy, it's probably somebody who's an idiot who did your exam and didn't look for the factors of what it could be.
This is your podcast. I wasn't going to say that, but that's usually what I say.
But it really comes down to, it's really not hard. It's either immune or inflammatory condition, right? Right. It's a nutrient deficiency caused many times by gutty issues or their medications.
Right.
It's a circulation problem. It's a blood sugar problem. It's a mechanical stenosis problem, but that doesn't fit the typical neuropathy that most people are familiar with. That's usually a little bit different,
Right.
but it's usually an inflammatory circulatory autoimmune disorder at the root of the issue. So I almost every patient I see who's got neuropathy has some level of thyroid condition, right?
You know, this is a point that I wanted to make with you earlier too, is when we were talking specifically about Hashimoto's disease, which is the immune system actually attacking the thyroid. We have a tendency, well, we don't have a tendency, but the medical community has a tendency to compartmentalize everything. So if your immune system is attacking your thyroid, then you've only got a thyroid problem, right? No, it's not true. Your immune system can be attacking anywhere else. It can be attacking the blood vessels. It could be attacking the nerves themselves. It could be attacking the joints, causing the inflammation, causing the mechanical problem. So when we see these patients that have these thyroid issues with autoimmune dominance, where else is their immune system attacking?
Potentially everywhere.
Potentially everywhere. That's why it's key to go back to the building blocks of the foundation of this, which is the gut.
Right.
And the gut and the brain are inseparably connected.
You got it. So let's talk about, because I know you deal with thyroid patients, and we usually try and give our listeners some information. When you are evaluating a new patient who maybe is coming to you for thyroid, is coming to you with hypothyroid symptoms, where do you like to start? What is your format for usually trying to help that patient out?
So number one, just like I said before, is they've got an autoimmune problem until I prove otherwise. And when you deal with an autoimmune problem, the first place you look is your gut. So my number one priority with the gut is digestion, stomach acid, and gallbladder. Okay, so we start managing, if we start working with their stomach acid issue, which we all see this, most people in this country don't have too much stomach acid, they have too little. And the stuff that they're taking omeprazole for is actually lactic acid from lack of food breaking down, not hydrochloric acid, but it lowers all acid, so it helps reduce the symptoms. So if they don't have a proper stomach acid response, they're not going to digest their food. Their gallbladder is not going to secrete bile, so they can't absorb fat. Their pancreas is not going to secrete an appropriate amount of insulin because of lack of stomach acid. And then once that food that's not digested properly enters the small intestine, then we start feeding SIBO, we start feeding the autoimmune process, we start feeding the leaky gut issue, and all of that spills over into autoimmune thyroid processes, autoimmune diabetic processes, brain issues, all coming from the gut. So we start with the stomach acid, then we start dealing with some food sensitivity issues. Number one, gluten is absolutely essential to get out of the diet. Then number two, we actually test for food sensitivity still, but we'll put people on an autoimmune protocol where we basically remove any grains. So we put them on meats, fruits, and vegetables is basically what they eat until we get the blood testing back. Then we start to bring stuff back that we know that they can have, and just treating things as we find them from there.
Okay. So I and Dr. Erica and I have talked about that quite a bit. Is there oftentimes that you have to do functional neurology treatments with them? Are you commonly doing that in conjunction, or how do you handle that?
We do it in conjunction. And I tell people all the time, we can start making you feel better by treating the nervous system from the get-go while we're waiting for this metabolic stuff to take effect. So we'll start getting them feeling better, but it's not until the metabolic stuff takes effect that it actually makes it stick, it makes it stay.
So one of the things that since we're talking about gut and thyroid function and we're talking about vagal tone, if somebody's got decreased bowel motility, they've got chronic dysbiosis, they've got decreased vagal activity, and we've talked about, I'm pretty sure we've talked about the impact of reduced vagal activity on reduction of stomach acid. We've talked about the link between reduced thyroid function and reduction of stomach acid. are there things that somebody can do, or what suggestions do you give people if you find they're sympathetic dominant and they have low vagal activity? What are some of the things that you may make suggestion-wise that they could start to do?
One of my favorite tricks is to have them just gargle warm salt water every night.
Okay.
You start stimulating the cranial nerves and it'll go back into your throat. They have homologous columns that are linked right with that vagus nerve. So you can actually start stimulating that pathway just by gargling warm salt water.
So does the gargling actually stimulate the vagus nerve, or does it have another effect that indirectly?
It's an indirect pathway that'll stimulate the vagus nerve.
Okay. So is there a way that the person could then know that they've got that vagus nerve stimulated?
Yes. Just doing that, they may see a difference in their bowel motility.
Okay. So if they saw improvement of bowel motility, because I use similar things, would you say that if they were gargling hard, or and sometimes I have them do some a little bit of gagging as well, if they stimulated some tears in their eyes, could we assume that they had appropriate some vagal stimulation there?
Oh, absolutely.
And can you explain that a little bit? I know it has something to do has something to do with the area of the brain, but for our listeners, can you explain how, even though it's not the vagus nerve, why maybe the tearing might give somebody a clue that they're actually stimulating the vagus system?
Well, tearing is a parasympathetic response. And so as the vagal nerve works off the parasympathetic system, but you also have to look into what are called homologous columns, which basically means, your cranial nerves, the ones that are born together, kind of stay connected together. So when you're gargling, you're stimulating cranial nerves that are in that same homologous column as the vagus nerve, which is in the same homologous column, which will actually produce lacrimation and tearing. So go ahead.
So essentially, all the nerve cells are all kind of in the same area of the brain. So when you stimulate one, you kind of stimulate them all. Right?
Exactly. And that's the pinnacle of functional neurology right there. Is if nerve A is firing to nerve B and nerve B fires to nerve C, you fire nerve A and it fires nerve B and fires nerve C. It fires that whole line, makes it more efficient.
Awesome.
Yeah, that's awesome.
Is there any other keys that you would give, like a patient you decide that they're sympathetic dominant, or is there some clues that they may be able to kind of figure out that maybe they've got sympathetic overdrive that may be compromising their gut function?
Go back to the beginning with the bad brain acronym. Okay? Brain fog, anxiety, depression, bowel bladder problems, retention, the sensory issues we talked about, insomnia, and nerve pain are all indications that you are in a sympathetic state. Okay? If we put that into simple terms, if your gut's not right, you're not going to digest food, you're not going to excrete waste appropriately. And that also will lead, you will also see issues in sex drive and libido. If you're experiencing those things, you're sympathetic and you need to do something about it.
Absolutely. Is there, as a functional neurologist, you're dealing with people with neuropathies, you're dealing with people with thyroid disorder, and I kind of already know this answer, but what conditions for somebody who has, maybe they have a hypothyroid condition, but maybe they've got other symptoms, what type of conditions are really helped via functional neurology?
So what conditions do we see? I'm confused.
Yeah, so if somebody said, well, how do I know if I need to see somebody who's got a functional neurology background? Why would they potentially have to see a functional neurologist?
If your metabolic problem has become, you remember the old picture of the old iceberg they used to show us in chiropractic school? The tip of the iceberg are the symptoms that are sticking out above the water, the ones that you can see. All the things leading up to that are below the water where you can't see them. The same is true in functional medicine and functional neurology. You guys know that.
Yeah.
Right? So the symptoms that stick above the water are going to be the people with burning, pain, numbness, tingling in their hands or feet. Their sexual function has decreased. They walk into rooms, forgetting why they're there. Anxiety, depression. These are all the symptoms of the part that's sticking out of the iceberg. So if you're, sticking out of the water, if you're at that point, you need to seek us out. Okay? There are the rest of us that want to be proactive about this. My grandfather died of Alzheimer's. I see my dad, the direction he's going. I don't want to be like that, so I'm proactive about this. I eat the way I eat. I live the way I live because I do not want that to be me. So if that is you, if that's the listeners, the people watching this podcast, if you want to be proactive to prevent some of this nasty stuff that happens down the road, then you need to seek people out like us.
That's awesome. Yeah, I definitely agree. And we say that often on podcasts. If you're trying to improve the quality of your health and you think you're doing all the right things and you're not getting to where you want to be, that's where you need somebody who's outside the box, who can look at this from a different perspective, who has more an expertise, that can give you the guidance and the direction to be able to move you in that. You don't want to get to a point where you have a pathology where then you must go see a neurologist or somebody who deals more with pathology.
Yeah, I think the keys is that if you're trying to improve your health and well-being, functional medicine, functional neurology, these are things that we want to start with first, because really what we're looking at is how well is the body's functioning. And if the body's not functioning well, it may not be diseased. You may not have a limp, you may not have a tumor or a mass, but if you have symptoms, you are in a state of dysfunction most times. And while functional medicine looks at blood chemistry and evaluates lab markers differently, runs different tests, the difference in functional neurology is the functional neurology test is a lot of times very similar to what your police officers doing during a DUI stop, right? We don't have to run these really expensive tests to evaluate somebody's functional neurology. Sometimes those are beneficial, but really it's simple things that can be done on somebody to really have them understand that their neurology is compromised. We are this kind of triad of structure, metabolism, and neurology, and you can't have a problem with one without having a problem with the other. Right. So in your exams, which I know is very similar to the exams that Eric and I do when we're doing a neurology exam, it's simple things, right?
It's so simple, in fact, that I met with a patient over Skype in England. And before I met with him, I had them buy a vibration fork on Amazon. And I taught the son how to do the exam on his 80-something-year-old dad over Skype. And I watched the exam unfold, and we decided that's something that we're going to be able to help.
That's awesome.
It took I think he spent like $8 on the vibration fork. Spent a little bit of time with me. We did the exam, and they're coming over here next month for me to help them.
Awesome. Yeah, it's amazing what can be done with very simple tests. Many times we don't have to do $30,000, $40,000 tests. I think one of my favorite tests or questions I ask a patient who's coming in that gives them maybe a simple understanding of how healthy their nervous system is can you put your socks on by standing on one leg, right? Do you have to hold on to anything when you put your socks on in the morning? And if they say, well, I have to sit down to put my socks on, that's a good indication that your nervous system's struggling, right?
Right.
Because you've lost that balance control center. And I see that with my thyroid patients quite a bit. Their balance is not good. Close their eyes, put their feet together, and they're wobbling. You put one foot in front of the other. They can't stand still because they're wobbling back and forth. The brain becomes compromised very easily when there's thyroid problems or chronic inflammatory conditions.
Definitely.
Brilliant.
So I think we covered quite a bit, right?
We have.
So Dr. Brady Wirick is out in Idaho Falls, right?
Yep, Idaho Falls, Idaho. What's that?
Tell everybody where you're located at.
It's Idaho Falls, Idaho. We are about 3 hours directly north of Salt Lake City.
Okay. And if they wanted to reach you on at your website, or social media, how would they reach you?
By searching my name, Dr. Brady Wirick, Wirick, or IdahoChiropracticNeurology.com is our website.
Awesome. And do you have a Facebook page or?
I do have an active Facebook page.
You should definitely check out his videos. He puts up some really informational videos.
On my personal page, right?
Yeah.
So if you're looking for some input on thyroid function or functional neurology, and when we're talking about gut function and thyroid function now, but I know Dr. Brady deals with a lot of different really tough conditions. Post-stroke rehab is something that you've dealt with in the past, right? Really significant neurologic conditions. So if you know somebody's really struggling with those type of really difficult neurologic conditions, they're not getting improvement in traditional neurologic medicine, Dr. Brady is definitely one of those people to reach out to and find out what he can do for you. I think what we'll do is we're a good half hour or so into this podcast. We can maybe finish with a couple tips for our viewers regarding how they know if they have a neurology-based problem. You already mentioned the bad brain analogy.
Sure.
So let's repeat that one more time so they got it.
So BAD brain is an acronym. The BAD is brain fog, anxiety, and depression. You get into brain. The B for brain is bowel and bladder loss. The R is retention. The A is anosognosia, which is a sensory problem you didn't know you had. The I is insomnia, and the N is nerve pain.
So these are all kind of crossover symptoms that we see in both cases. If you're searching out somebody to help you with your thyroid condition, your thyroid symptoms and problems, and maybe you've gotten some help with thyroid problems, but you still have some of these issues, you really want to reach out to a functional neurologist because the functional neurologist is going to evaluate you differently than a traditional medical neurologist will. We're going to be looking at how the body works, not necessarily for disease or pathology.
Right.
You probably are not showing up in Dr. Wirick's office or Dr. Riggleman's office or my office if you've got a mass or a tumor and that's your primary issue. You're probably going to show up in our office because you've got this weird numbness or tingling in your arm, or you've got neuropathy and somebody's told you it's neuropathy, it's neuralgia, here's a medication, you got to deal with it. You have depression, you have anxiety, you take this medication, you deal with it. So if you have vertigo, imbalances, if you've got any of the symptoms Dr. Brady mentioned, along with looking for a functional medicine practitioner, you want to find somebody who's got some background in functional neurology.
Yep. Perfect.
Dr. Erica, any parting remarks today?
No, I just think this is a great resource for our listeners. We've talked a lot about the functional medicine side, and one thing we haven't really dived into is the neurological side, which is so important. And I just want to thank you for coming on and sharing your information with our listeners.
My pleasure. It's been awesome.
Erica, why don't you tell everybody where they can find you again?
You can find us at brainandbodyhealthcenter.com and Brain and Body Health Center on Facebook, and you can find us on Instagram at Drs. Riggleman.
Awesome. And you can find me, Dr. Eric Balkavich, at chronicconditionrecoverycenter.com, thyroidproblemsdoctor.com, and if you're really interested, methylationdoctor.com. It's funny. I have to do a podcast next week, and somebody asked me to send in my SM. And I was like, what is SM? And they're like, social media? I'm like, oh, that's why I don't got that. Yes,
We're behind the times, Eric.
Yes, I am on Instagram. I don't know what it is. I think it's Dr. Eric Balkavich. I'm not sure. But you can also find my Thyroid Thursday videos on YouTube, Vimeo, and on my site. I believe Dr. Brady is also, are you doing your Thyroid Thursday videos?
I haven't done those in a while. I've been doing a lot of neuropathy-based stuff.
Continue to do those. Check out check out his videos as well. You can probably find those on YouTube as well.
Yep.
Awesome. So we appreciate you coming on the podcast. We'll have to have you on in the future. We'll talk about something else that's neurology / thyroid related. But we really appreciate you being on today's show.
That'd be awesome. Thank you.
Yeah, thanks.
All right, let's sign off. All right.
All right.
Hey, smile for a picture, guys.
Can you do that on there? Can you get us?
Gotcha.
All right, Dr. Erica, Dr. Brady, we'll see you guys another time.
Yeah.
All right. Thank you.
Take care.
Yep.
We'll see you.